How do nurses portray a different lifestyle in their personal lives compared to their life in the workplace, particularly in regards to intellectual empathy?
Our purpose is to collect clear, precise, and accurate information regarding intellectual empathy and nursing.
We are doing this in order to learn how nurses' lives differ from work and home life. Nurses are some of the most caring people of our society, and we are seeking the knowledge of how this trait plays a role in their lives.
In order to test our ideas and gather the information needed to clearly answer our question, we decided the best way to go would be to interview a local nurse. Lauren Johnson is a nurse in the ICU of Norton Brownsboro Hospital. She was a very credible source to help us. She has a very busy schedule, so we interviewed her through email and are going to reenact the interview within this video.
Do you have to have more intellectual empathy on the job than you do at home?
I would say yes, because I am taking care of people I do not personally know who are critically ill. When you check into the hospital, you lose control, privacy, etc. I have to try to get to know my patient in a very short amount of time. I have to learn their past experiences to understand their current state of mind. Both of these aspects have a major impact on how I tailor my care for a particular patient. In addition, I have to try to put myself in my patient's family's shoes. I have to try to understand what they are going through and provide support during a very difficult time in their lives.
Is this conscious, or is this expected of you as a nurse?
I don't think that this is always a conscious process. I feel that as nurses we inherently possess this trait. I do feel that sometimes nurses have a hard time tapping into this trait because oftentimes we are so busy and stressed out. It is very important that we stop and take the time to empathize with our patients and let them know we truly care.
Is it hard sometimes to have this empathy for patients?
Yes, sometimes it can be difficult at times to empathize because our shift focuses onto the tasks we must perform or the charting that must be done. We can get caught up in the stress of our to-do lists and forget about the big picture. It is important to realize that we give holistic care, including empathy and emotional support.
What kind of intellectual empathy do you think you have to use at home compared to at work? Is it any different?
I think the concept of intellectual empathy is the same across the board. The main difference is I am taking care of complete strangers while they are in a very vulnerable state. They are putting their trust in me to not only treat their condition, but also to advocate for them and maintain their dignity. At home, I know my loved ones. What they have been through in the past, their current opinions in certain topics, their personality traits, and how they react to certain situations. With my patients, I have to learn all this in a very short amount of time.
Do you think all nurses have this empathy, or are there some that have more than the others?
I do think that most all nurses have this empathy. It is what called us to be nurses. Like I mentioned before, I do think some nurses get caught up in the task side of nursing and lose sight of the emotional support side of nursing care. I think this intellectual empathy is what sets the exceptional nurses apart from the typical nurse.
Has the amount of intellectual empathy needed for your job caused you to think differently in your life?
Yes, the amount of intellectual empathy has definitely caused me to look at my life differently. Countless times I have had to take care of patients who had sustained a traumatic injury or who were actively dying. I've had to explain to their families that they would either not be the same person they remembered or that they wouldn't make it out of this condition alive. I had to try to put myself in that family's shoes and give them comfort during this unimaginably difficult time. It made me look at my relationships with my loved ones. I want to make sure that I enjoy every moment with my family because life is so fragile. I feel that my intellectual empathy is a trait I adopted at a young age. I feel that I was just born with it. I do feel that I've had to tap into it on many different levels, and that has helped me grow as a person outside of work. From Lauren's interview, we gathered 3 inferences and interpretations. The first thing we gathered was that intellectual empathy is sometimes challenging to keep up with us on the job. This is because nurses have so many things to do during the day that it's kind of hard to keep up with the intellectual empathy side of things. The second thing we gathered was that intellectual empathy is universal in nurses' lives except for one fact. And that one fact is that they only have a short amount of time to get to know their patient while they know the other people in their lives really well. The third thing we gathered is that intellectual empathy is a trait exceptional nurses must have. Amazing nurses possess intellectual empathy in their everyday work, and Lauren told us this in her interview.
What ideas are we drawing our interpretations off of? Our prior knowledge of nursing,
Our knowledge of critical thinking.
We're assuming that what Lauren says is true for all nurses, which is something we don't know to be a fact. So we are going off of her word. Does this mean that everything she says is true for all nurses? Not necessarily. We need to be conscious of this bias. We also need to possess enough intellectual humility to know that we can't possibly know everything about intellectual empathy and nursing by one interview.
An implication of our thinking would be that in order to be a nurse, you have to have intellectual empathy. In order to be fair-minded, we must address this and say that it isn't true. Not every person is the same. A consequence of this implication would be that we may give people the wrong impression of nurses. It is very possible that there are nurses that don't possess this trait, so people need to be aware of this too.
We are coming from the point of view of college students. We obviously aren't nurses yet and haven't been in nurses' shoes. That is why we got feedback from an actual nurse. By doing this, we eliminated biases we may have had if we just took information from our prior knowledge. Getting information from an actual nurse was very credible in the fact that she knows firsthand if nurses use intellectual empathy or not.
We use the elements of thought to conclude that nurses use intellectual empathy in their lives inside and out. It is one of the most important traits that they have.